Welcome. Good evening. And welcome to VitalTalks, where leading health experts cover the latest solutions to the world's biggest problems. My name is Steve Hamill. I'm Global Lead for Policy, Advocacy, and Communication here at Vital, and I'm really excited about tonight's conversation around how media shapes public health. I want to take a few minutes to set the stage. The field of public health is in crisis. With just 6 years left for the Sustainable Development Goals, 50% of them have shown insufficient progress, 30% have stalled completely or even reversed. And trust is the glue that we need for collective action around the SDGs. But Gallup's annual poll on public trust shows that it's the worst that it's ever been. The lowest level since 2006 when they started the survey. That includes trust in government, corporations, religious institutions, health institutions, philanthropy, and civil society. And at the same time, the reason why we're here, media is playing a greater role than ever before in our lives. From 2011 to 2021, here in the United States, media consumption increased 20%, and now the average person watches 11 hours of media per day in this country alone. And we know that the global picture is the same, right? So from remote villages in Mongolia to the world's capitals, nations over, people are spending more time on more channels, more types of diverse media than ever before. Media is increasingly the lens through which we see and we understand the world, including who we trust, what behaviors we consider acceptable and desirable, and which policies we think are important to advance. I want to share one campaign that we launched recently on overdose prevention, and I know that these days campaigns are much more than 30-second ads. Maybe our panelists will talk about that a little bit, but I just want to share one ad that encapsulates our approach on overdose.
I contracted Hep C from sharing needles.
When I got introduced to harm reduction, little by little, I started making changes in my life. It took me out of all the misery I was living in. I started a crochet class, and I would teach them how to make a hat, a scarf. Stuff that I crochet, I give it away to people in need. I used to be there at one time. Harm reduction saved my life.
It's such a simple story, but it illustrates that media can change the lens from stigmatizing people who use drugs to seeing them as individuals with dignity, the power to change and contribute back. And media can also be the difference for people who use drugs between seeing services as a place where some doctor may demean you or judge you to a place where other people who know your lived experience will welcome you, empathize with you, and help you. And it can also be the difference between seeing jail and punishment as the way to deal with today's overdose crisis to believing that we can solve this crisis by building up help services. And when we evaluated this campaign, the thing I'm most proud about is that the support we built transcended political affiliation. This campaign launched the same week that a number of US senators labeled new harm reduction grants from the federal government as crack pipe giveaways for poor neighborhoods. And our campaign became a really important counterpoint that held up lived experience without delving into partisanship. So campaigns like this are a win-win proposition that can both promote individual behavior changes and keep public discourse centered around health. And without stories like this, we're leaving public health vulnerable to politics and disinformation. Sadly, we're seeing many institutions backing away from investing in media campaigns. The most recent WHO Global Tobacco Control Survey showed that only 22 out of 180 countries ran significant campaigns in the last year. That's the fewest ever measured. This matches what Vital Strategies has been seeing in countries, in our portfolio of 7 countries, smaller budgets, reduced staff for media efforts in government, in development-funded work, and in philanthropic programs alike. But if we want urgent action on the crises that threaten global health and well-being, we cannot walk away from using media as an essential tool. And our panelists today have shown conclusively that despite this increasingly complex and difficult environment, media can be harnessed for change, for tobacco control, for food policy, on climate action, and other existential areas. They're leading campaigns that improve behaviors, millions of people at a time, that are building demand for new policies and changing public course and changing culture. So I'd like to introduce them to you. First is Sandra Mullin. In 2007, when Vital Strategies, then called World Lung Foundation, was tapped by Bloomberg Philanthropies for a massive effort to drive down tobacco use around the globe, Vital hired Sandy to build a global media program. She leveraged her experience at New York City's Department of Health as Director of Communications, where she oversaw both media relations and a vast array of programmatic communications work. And in that role, she was also on the front lines of crisis communication for September 11th attacks on the World Trade Center and other health emergencies. She further honed her expertise, which she brought to Vital as head of communications for New York City's legislature. And the tobacco program that she worked on still works in countries covering 52% of the world's population, more than 4 billion people. And in 2007, when we started this program, none of these countries had ever run a national media campaign on tobacco. 16 years later, those 11 countries are not only running campaigns, last year they invested $50 million in their own money in campaigns that cover tobacco control. So as our Senior Vice President for Policy Advocacy and Communication, she's led our communications team in bringing these same approaches to work on food policy, overdose prevention, road injury, air pollution, and more. And she'll be tonight's, in addition to being a resident expert, she'll be tonight's facilitator. Thank you, Sandy. Yes, and next, at the far end, I'd like to introduce Dr. Barbara Shillow from the Truth Initiative. And we know there's no organization with greater evidence that communication and media can change culture. Truth has demonstrated conclusively and concretely that their cutting-edge campaign work changed the attitudes of generations about tobacco use in the tobacco industry. In fact, Truth's campaign has been so successful and with such sticking power, they had to rename the organization after it. And they've continued to have an impact with new issues, including vaping. They've been pioneers of bringing the best know-how in advertising to public health, including world-class research from Truth's Schroeder Institute, which Dr. Shillow leads as Chief Research Officer. Welcome, Dr. Shillow. And last but not least, I want to introduce Eileen O'Connor, Senior Vice President of Communications, Policy, and Advocacy at the Rockefeller Foundation. Eileen's career includes work in the Obama administration, principal at a crisis communications firm, and vice president for communications at Yale University, among others. And at Rockefeller, she serves as special advisor to President Dr. Rajiv Shah and leads a team using advocacy and communications to advance the foundation's big bets, which are bold, broad, multi-year initiatives that address large-scale programs. She and her team also led ambitious efforts over the COVID pandemic to better use communication to promote health and counter misinformation. I bet we'll hear something about that tonight. Welcome, Eileen O'Connor. Yep, over to you, Sandy.
Thank you, Steve. We could sort of all leave now because Steve has basically made the point that needs to be made about where we are in public health and where the state of media is. So thank you all for coming. Really appreciate you spending your Wednesday evening with us. So I'm thrilled to be moderating tonight's discussion, and I will take the license of every now and then opining on what we're talking about. So I won't be I won't honor the moderator role as faithfully as probably one should. So just expect that every now and then I might jump in. Thanks for that. And I'm really proud to have done the work that we've done at Vital for over all these years and in about 75 countries. Steve, I think, said 7, but he meant 70 if you heard it the way I did, but he meant over 70 countries. And we really both feel proud of the investment that governments are making, and there's so much more to do. So let's just jump into the discussion. And I'll just begin by really asking both of you to comment on sort of where we are in a world of alternative facts. This is something that we face in almost every issue that we work in. It was front and center of the pandemic, not just in this country, but in other parts of the world. And as truth seekers and truth tellers, it's really difficult, and thanks for having such a great name for an organization. It's really difficult to sort of recognize that that's not enough to convince people and persuade people, both policy-wise and behavior-wise, about what the right thing to do is. So how do we deal with that? Barbara.
Yeah, I'll start us off. I think at Truth, we're really about the opposite of alternative facts. And I think the proliferation of alternative facts has really driven home the need for the process that we've really followed throughout the decades that we've done this research, but I think it makes it even more important. We do so much formative research before we ever even really, imagine an ad or talk to our creative agency. And for us, when we're trying to reach youth and young adults, it's really understanding who our audience is, what resonates with them, what are the issues that they care about, and where are they at? Where are they getting their information? And I think everyone in this room knows that's TikTok today. It might be something different tomorrow, but we will go where our audience is. I think it's also making sure that we ground our campaign messages and evidence as well. I mean, we are Truth Initiative. And so our latest campaign, for example, talks about the theme of it, the overarching theme is it's messing with our heads. And so we identified mental health as an issue that young people care about, and then really looked at what the science said there. What does the evidence say about the association? And indeed, we see research that shows that exposure to nicotine can amplify feelings of anxiety and depression. And so it's about doing that formative research. It's about making sure that our message is evidence-based, and then it's about going to where young people are at. And so I think that's a formula that's worked for us. But this, again, the context of alternative facts and fighting disinformation really drives home the importance of that.
Yeah, I just want to make one comment on what you said. For those of you who are too young to remember how truth began, I remember 25 years ago, you guys were doing ads with actors playing dead on the streets of places like New York, and body bags, and really bringing home to people what the impact of tobacco use was, particularly trying to get young people involved. So using that data and using the visual way in which you do your stuff has been really powerful. I just wanted to...
And today, as people have aged out of our cohort, there's a whole generation that remembers that ad.
Eileen, what do you think?
Sorry, I'm losing my voice. So, well, I think alternative facts is actually a business strategy, unfortunately, because emotion drives clicks, keeps you online, keeps you seeing advertisement, and that really is how social media makes money. And so, unfortunately, that also makes it, those algorithms keep you locked into certain information silos, which actually, because that's your group, that's your tribe, it actually makes it much more difficult to turn someone from those facts, even well-educated. It's a misnomer that uneducated people believe in alternative facts or whatever. That's not true. Actually, people who are really educated, it's harder almost to get them out of those loops because they can effectively argue against it. And so what we found is that, that has really made the typical media landscape broken. So we have to go into those information silos, find the influencers, get them the facts, and convince them that what they're hearing, seeing, et cetera, is misinformation. These are the facts. And by the way, also, you have to fight emotion with emotion. And so like during COVID saying, if you want to protect your family, if you want to protect your community, if your neighbor could die if you infect them. So you've got to really kind of fight fire with fire. And I think from a policy perspective, more and more, we want to fight with policy and try to get the social media companies to, they argue, when I've said this, you have to control your algorithms, they argue, oh, that's censorship. And as a former journalist, mostly in war zones, really offends me because I'm saying I actually got shot at, to tell the truth. So that's outrageous that you say that. And also, you're making money off of misinformation. You are purposely your algorithms are purposely advantaging emotion. And so therefore you are censoring the truth. You are censoring cold, hard facts, the kind of facts you're bringing out. And so while I say fight fire with fire a little bit, I also think that we have to, as a nation and even as a global community, we've got to recognize that these algorithms and that the business model for social media is not just destroying public health, but it's also destroying the ability to make good policy.
Yeah, great points. I mean, you know, your point about how uneducated people are not the only people who believe misinformation is, I think, brought home for me by how many people still believe that the 2020 election was stolen. I mean, that's a large percentage of people, largely Republicans, but just a U.S. comment, but absolutely interesting point about how to influence the social media companies to change their algorithms. I think it's something it's a hard yards because, you know, it's just such a ubiquitous part of everybody's lives, and it's working for them, right? The clickbait is working, so hard. I'd love to hear a little bit more about how you dealt with this during the COVID pandemic, because Rockefeller did a lot of work during that time. I mean, as did Vital Strategies, but tell us a little bit more about that.
Well, we did some advertising. I don't know if they want to show one of them, but what we did is
Let us know when you're ready and they'll play it.
Okay, I'll just do it in a second. So each of these are like really community-based advertisements. So what we did is we worked with community leaders as to what would actually convince people in their communities. And I have to tell you, there's one in New Orleans. It was actually a rap singer, Big Frida, who did a rap song. I wish we had that one, but I mean, so our goal was to have the same amount of shots in arms with underserved minorities and underserved populations who were skeptical and mistrustful for good reason. And so we really went, as you said, where they were, churches, other places, but it was the messaging that was also critically important, and we went to their community to find out what would convince people. So
I got vaccinated to travel and see what I've been missing.
I got vaxxed so the flock can gather again.
To continue keeping our city clean and healthy.
To get back in the game.
To protect our growing family.
La vacuna es tu mejor guardia.
The vaccines are proven to be safe for expecting and new mothers.
Encourage your family and community to get vaxxed while you still can.
It's Baltimore versus COVID. Let's win this together.
I think, you can see that the emotion, it's about protecting your community, your colleagues, your family. So I think that was where we really tried to target.
Yeah. For truth, with COVID, we understood early on that our target audience would be heavily impacted. I mean, the impact of the social isolation for teenagers and for even young adults was significant. And it impacted vaping. We actually saw rates go up for young adults who were still largely able to get vaping products, maybe a little bit less so for teens. But we saw the industry step right in and message, stay sane with Puff Bar. And so we knew that we were going to need to be there. But we did it in a stage strategy. The first thing we did was a short campaign that was really focused on just connecting and staying connected with our audience, recognizing that this is hard. We know what you're going through. It was called Work It From Home, WERK. It was a series of short videos with little fashion runways that people could do wherever they were quarantining. And so that was our way just to stay connected with our audience. And then the next thing we did was we found a popular young MD on TikTok. And he started to introduce a medical message talking about, vaping adds one more risk to what's already a risky situation for all of us as we face the risk of COVID. But we knew because the industry was out there taking advantage of this moment, we got busy with our next campaign. And again, when we asked young people what they cared about, mental health rose as one of the top issues, really even before COVID, but amplified, I think, during COVID. And we developed a campaign that was really built on the message around nicotine is messing with your head, and the industry is messing with the message around nicotine. And that campaign has been very successful.
I mean, one of the things we worked on at Vital during COVID is a campaign called Be the One. We came up with that sort of nomenclature after working with a couple of an ad agency and a community-based research agency to try to get Black and Brown communities convinced of the importance of contact tracing. Very difficult. And obviously, I think we all know that one of the reasons that was so difficult is because of the legacy of public distrust in medical institutions and in all kinds of institutions, which is sort of a reminder to us that you can't start building that trust in the time of a crisis. You have to start building it before. And that's not exactly communication, but it's ancillary and really core to good communication, particularly, as I'm sure you know, Eileen, during crisis situations. So trying to even get the numbers of people who participate in contact tracing up was extremely difficult, as we know, throughout the United States. And this distrust is something that I think is continuing and we need to sort out.
I mean, advise the Department of Homeland Security, and we do tabletop exercises for the governors and mayors around the country on all sorts of hazards, like public health hazards, biohazards, terrorism hazards, floods, earthquakes, et cetera. And one of the things that we've always talked about is what you just said, which is you cannot start building trust at the time of the crisis. You got to be building it way before with public education campaigns and also with making sure that you're finding those right community leaders that you can get to and that network of folks. Because unfortunately, there's now the emergency managers are finding that, they're telling people to go to X place away from, say, a disaster, and there is misinformation trying to drive people to a dangerous situation. Yeah. And that's just horrible.
Yeah. So I want to ask about where communication sort of sits within the public health arsenal of work. In my experience, we're often an afterthought to some of the programmatic work that's happening. We're not just an afterthought to sometimes our own colleagues, the epidemiologists, the researchers, et cetera, but to the donor world. And I have a bunch of theories, some of which are not scientific at all, but one is that communication is so ubiquitous that everybody thinks they know how to do it. And in some ways, that devalues the investment that's needed to do communication well. So I'll just throw out that, again, unscientific comment of mine, but how do we get donors, investors, our colleagues, our bosses, our organizations to see the value of media? I mean, we can prove it through our evaluations that the return on investment is worth it. But I mean, Eileen, you're a donor as well as someone, as a professional in this field, but I'd love to hear your thoughts.
Well, we actually track the advertising dollars that earned media would equal. So if we get an op-ed in the New York Times, and so that takes a lot of labor and a lot of research, and to your point, and it's a lot of relationship building. So that's an intensively expensive thing, and can be. And so we really do kind of measure that against that. And I would just say that that's another thing is, Rockefeller Foundation is not the largest endowment. And we're actually 35th in terms of size. Everyone thinks we're not, because we actually do a lot with communications. They think we're like the top 10, yeah. And in fact, somebody at Gates said to me, when I told them how much we can give out every year, she said, "Oh my God, we give more to our polio vaccine initiative than you give yearly." And so I keep sending people to you saying, "Oh, Rockefeller has a lot of money." And I said, "No." But we try really hard to bring other people in to coalition building. And I think, but that is really about communications. And as you know, because you do this, policy and advocacy, good policy begets partners.
I think bundling up ROA for earned media makes a lot of sense. Do you have thoughts on that, Barbara?
Yeah, a couple of things. I think when we think about trust and bringing in donors and raising awareness of the effectiveness of our campaigns, I think one way that we do that, and we should challenge ourselves to do it even better, is through partnerships. And so, there's not a lot of entities that can do a big national tobacco control, prevention, cessation campaign. And so what we really are focused on and have been focused on now for several years is extending the impact of that through our partnerships. And I'll use New York as an example since we're in New York City. We've had a partnership for several years with the State Department of Health where they can tag their materials with a special key code that will bring youth and young people to our Text to Quit program. This is quitting. We will allow them to use our campaign materials. We'll help them out with press releases. We're real true partners in that. And I just think that's just one way of extending the impact of the work that we do. The other thing I'll say too is just, getting better at touting our success. I mean, I'm working with researchers in my group and we're the ones calculating all those fancy statistics, but you got to package it in a way that really drives it home. I mean, I can tell you what our ROI is and I can tell you what our cost savings are, but how does that compare to anything else? And so I think that's a challenge for all of us in the field.
Can I just add one thing donors should do, which is we're starting to do this more. We have these things called funders table, and we're trying to also make sure that we're not just, funding the same old people. We're trying to do more locally led funding, et cetera. And so we're really trying to compare notes as to what we're funding, what's working, what's not, and then bringing in NGOs to say, hey, you guys should also join forces. And the ones who do this well, do that. The ones who do that well, you do that. Don't go after all of it. Figure out what you're good at and then do that.
Yeah, and I think that's a trend that is happening in funding all over, in many donors that locally led initiatives are really the ones that are being funded. I'd love to sort of throw out a question to the audience a little bit, but maybe I'm not supposed to do that now, but just about sort of the role earned media is playing in this sort of constellation of the work that we do. We've been around a while, as you can see from who we are, and we've seen the media landscape change dramatically. And I think that we are all studiously aware of that and watching the trends, and have lots of young people on our teams who are really savvy about digital and social and all the media platforms that are available to us. But I mean, this is both a fantastic new world that we're in. It's also a worrying new world in that anybody can communicate anything. And we've talked about alternative facts and some of the misinformation that we see, and you've talked a little bit about how to address that with social. But I'm wondering about the earned media world and how that has really evolved and changed, because it's a hugely important part of how we communicate in public health. It's not all about buying ads and doing paid media. It's a lot of organic media. So I'd love to hear you comment on that.
I think there's a couple ways you have to do that, which is, sorry.
And there are journalists in the room who no doubt have thoughts in their minds about what they...
You have to really figure out who are the influential writers or reporters, try to go to them. Look, there's still a lot of mistrust around the New York Times or Fox, depending, or MSNBC. Media has become more partisan, so you're going to have the same thing of some people are going to trust that one, some people not. So you really have to take a broad lens. But earned media is to their audiences often more trustworthy because it's independent, but that means you also don't have control over it, and you don't have control over the headlines. And we've had a few, where the headlines was a little alarming but the body of it was fine. And I think, you have to understand that you're taking a risk, but we think the risk is worth it. And if you're educating a reporter, then that's good. And it doesn't have to be about your organization. Bring your experts to the reporters. And I always say to my team, we should be a resource for the reporters because they'll come to us and they'll use us and they'll ask us even, can you help me find another expert? I don't mind doing that either in another place, because then when I really want them to write about something, they kind of, they will take more interest.
Yeah, well, I'm sure that we'll get questions about that at some stage. I'm sorry, I'm moving around too much. Okay, it's you. Okay, but yeah, I think we're never so happy as when we get a big story in some outlet when we landed a story on our CRVS program in the New York Times Magazine. It was like, ooh, a lot of work went into that. So it does take a lot of work to get the stories that you want to get on those platforms out there. Curious about COVID, because I want to sort of come back to it, because in some ways, to Steve's point, that really, I think, put a stamp on the distrust in so many institutions that we're still suffering from today. And just wondering what lessons we have taken from that in public health. And we have a campaign called Reimagining Public Health, just as a sort of way of framing how we both want to sort of not only have people understand the relevance and importance of public health, but how we as public health folks working in public health communications also have to earn that trust. So I'm just wondering if you have any reflections on what you learned from that and how that's changing how you work going forward.
Yeah, I think for us, COVID was, one of those shocks to our culture and our society that really forced us to pay attention to thinking about the impacts on our audience. And COVID won't be the last of those shocks to the system, if you will. And so really just paying attention to what it means, for all the generations of young people that we work with and message to, and the lasting impacts of that as well. And so, I think that's been a big lesson that we carry forward in our work. I think that's probably one of the biggest lessons. I think the other is just that, we need to be flexible and adaptable. And I think for us in tobacco, we understood that in 2018, which was a real inflection point. I mean, we had decades of experience and success in addressing combustible tobacco use, and then all of a sudden, Juul and e-cigarettes hit the market. And, we could take some of what we learned, but we had a lot of new things to learn as we moved into an era of denormalizing vaping and normalizing quitting for a generation that really had not been exposed to nicotine. The data early on showed us that, high percentages of young people didn't even realize that vapes included nicotine, and then they woke up one day and couldn't understand why they couldn't put their vape down. And so I think, all of that, moving forward has really positioned us to understand that our audience will continue to evolve and change, and we need to with them.
I would also say that we have to have a feedback loop, because in order to be adaptable, you got to understand what's changing amidst your audience and their understanding of things. And so that's hard. And so we look at comments on social media, but you really have to also just engage personally. We do a lot of convenings of people, and I think that that's a big lesson. You got to create some way to get feedback throughout this, because yes, the pandemic changed and there's different audiences and different needs, and I think you really need that.
Yeah, and gone are the days of doing an ad, a one-way communication. Everything is about two-way communication. I think that this is a great moment to open this up to questions. I think Allie was indicating that to me a minute ago. There she is with the mic. So would love to hear from all of you, because I think that will provoke maybe better questions than I've even asked this panel, to just sort of, broaden or deepen the conversation. So can I ask folks to volunteer to brave questions? Oh, here's one from a journalist, so be careful what you say.
Although I hear Rockefeller doesn't have money, I'm not sure who I'm pitching the question at, but let me try. What I've been struck by is that there is so little investment in good journalism, which is not getting money at this stage. I think that Stop Tobacco has been an amazing initiative, because they've exposed the industry, and they've invested, understanding that investigations take ages, and they've given money, and brilliant stories have come out. But I don't see that kind of commitment from anything else. I mean, fossil fuel industry. Why is there not a group that is looking into what they're doing? So possibly for donors, a challenge, but also not only that, not only protecting the space and exposing, but also going after the liars, litigate against them. Nobody seems to have the appetite for that, but that is how you stop lies, surely. Thanks.
There has been some litigation. Some children, I think it was in Colorado, have sued. The fossil fuel industry is spending at least 10 times as much as sort of NGOs or others or us donors on fighting climate change. And that is outrageous. And because people are literally dying. The IOM, which is the main international organization for migration under the UN, for the first year ever, climate change is actually the main driver, not violence, of migration. That's insane. But it's true, and we're not addressing it. And so I just had this conversation with a bunch of journalists. There's a bunch of donors in the room, so-called media impact funders, and we're trying to figure this out. NPR is having a devastating year, and that's a publicly funded and also privately funded. So local journalism is getting destroyed. And again, this goes back to the business model of social media. So there's got to be some other way that, because they take the content from journalists and they use it for free on their platform. And so there's got to be and everyone's kind of trying to figure out, what the reimbursement models are and subscription models. And so, I mean, it's hard, but I would say to folks, you got to subscribe to a couple of good journals or newspapers, because getting most people, over 80% now, it's the numbers fluctuate, get their news through social media. And so the problem is they're not subscribing. And I was just at a dinner with the new editor of the Wall Street Journal and someone in the new head of CNN, and look, even the national organizations are suffering. So we're gonna have to figure it out, because that is also affecting truth. Vladimir Putin is great, and I was in Russia at his dacha tea, and with a bunch of other Russia experts, and I asked him why he was cracking down on independent media, because he had always told me he was against corruption, and he said, there is no independent media. Whoever owns the media owns the truth, and there is no truth. And that is so true. When you have, just all these conflicting facts, to go back to your first question, you have no truth. So I really think that fact-based journalism is something we have to invest in.
Yes. I'll just add that even though we're greatly outspent by the tobacco industry, we have efforts underway. As a researcher, I lead a group of academics and researchers and advocates, policy practitioners, to address the scientific integrity of tobacco and do all the work that we can to try to strengthen conflict of interest policies and disclosure policies. So our own public health journals are failing in many regards, in many respects to that, and we can do better because that's part of the industry playbook. They're trying to legitimatize their efforts. If you go to PMI's website, they're the champion of everything these days. They're the champion of the environment, the champion of correcting mis and disinformation. I mean, it's just kind of unbelievable. Everything's been turned on its head. Yes, that's right. That's right. There's that. So, we're a small but mighty group, and we're doing our part to at least work with the main scientific associations and groups within public health that are focused on tobacco to address this.
So you mentioned, by the way, great conversation. I know you mentioned a lot of evidence-backed journalism and the importance of investing in that. I'm curious, and this is a question for the three of you, what strategies you believe has been done and has been working to gain the trust of a lot of, for example, majority of the youth today, receive a lot of their information from social media, and there is a lot of pushback and mistrust in mainstream media, right? And I think due to a lot of different factors, right? Whether political and how that impacts, then once those same outlets are pushing public health campaigns, there's already that mistrust there. And people are like, okay, well, there's so much political divide, I think, specifically in the US right now. And I think that it's definitely impacting a lot of other sectors, whether that's education, whether that's policy, whether that's economics, whether that's health, public health. So I'm just curious, what are some of the strategies to gain that trust, and where do people go to for evidence-based data when a lot of that has been misconstrued within mainstream media?
I'd love to answer that. I'd actually like to show our ads, because we have a social influencer ad, and I can talk a little bit about that strategy that I think will in part address your question.
Around me was trying to quit. So it was just like me literally versus me. And that's not easy. And the reason this partnership with Truth even happened is because I was telling someone that I just want to work with someone or something that is actually making a positive change, where I can share my struggle and help just hopefully one person beat this, because it's not fun to feel alone in doing something like this. Support is absolutely crucial when you're breaking an addiction. And not only is Truth a free support program, but they're the first company that wanted to have a real conversation with me and made me feel very seen and cared for, honestly. And that's the kind of honest work I want to do, and that's what I want to use my platform for. You can sign up the same way I did. You just got to text Join Brianna to 88709. I promise I get you. It's not easy.
So the second piece, the first piece is, sort of our air cover ad, right? Our national buy, and you can see the connection to mental health. But the second piece features Brianna Salas, and she is part of our Quit Collective. These are social influencers with significant followings that are talking about quitting organically. And we're finding them and connecting with them and really validating their experience. I mean, those are her own words. Now, we are sharing with her resources that she can share with her followers in terms of, folks that want to enroll in our This Is Quitting program. But I think that this strategy, where we have a lot of impressions and views and the comments are positive, these are authentic voices that youth can connect with. And she's just part of a growing group of this Quit Collective social influencers that we've leveraged. And I think this will be incredibly important. It's also highly cost effective in terms of the investment. So,
yeah, that's terrific. Do you want to add anything? Or?
It's a great question, and I don't really have a good answer. I mean, because it's just really hard, because we're so partisan, and when you have people calling journalists the enemy of the people, and journalists literally being targeted, it's just something when I was fighting war zones, we used to put write out press on our vehicles, because according to the Geneva Conventions, we could be protected. Now you're a target. And that became, over time, we were targets for kidnapping and other things. But I just think that's evolved during my lifetime. And I really think that it's so damaging that I think government officials don't understand how damaging it is to call the press the enemy of the people, to question everything like what I just said. And when you question everything, there is no truth. And so no one believes anything. And so I think that's the strategy. It's the strategy of people who, it's part of the rules of propagandists. And so unfortunately that is part of the political landscape. And I don't know the answer.
Yeah, it's a tough one, but I do love that you got on a platform with an authentic voice to speak to people with inauthentic voices. And I think going to where that information is coming from, getting young people to speak out about these issues and really thinking about authenticity and storytelling that is believable and more credible than the bad stories that are out there. But thanks for that great question. Kesu.
I really appreciate the fact that you both had different responses to your question, which I think is a great question, because I think part of it shows a certain level of integrity. You're different organizations and you hold a different place in this as communicators. So I love what you guys did, and I don't think it would have worked the same way. If Rockefeller Foundation employed the exact same strategy as the Quit Collective. So I really appreciate that. And I wanted to like piggyback off your question in terms of earlier you mentioned how building trust is difficult, but also it's important to build trust when you're not in the fire of a crisis. And I think you gave one answer. You gave one answer about kind of like optimizing the funder circle. That's one way of, but I guess my question for both of you is, internally within your organization, can you give me an example of how you do actually, it must be so difficult to essentially get funding for this idea of building trust when we're not in crisis. That's something that has to happen, but I imagine that's the hardest sell of all sells, because it doesn't have a hard, there's not like a clear ROI, but you have to believe in this idea that we're constantly, so how does that manifest in your organization? Like, is there a way that you can point to that you're saying, this is how, independent of what's happening right now, this is how we're building trust for our audience, and this is our strategy for it. Yeah.
I mean, I think, a lot of it has to do with relationships. You've got to really reach out to a lot of different people and audiences and people who those audiences trust, and really build relationships and build that trust on a sort of personal basis, as well as on, and I think the other thing is, we do stuff like we call it trolling the news. When there is an issue in front of people and people are really paying attention, because I have to say, attention is not easy to get on an issue, right? So when someone is paying attention, we try to insert the education that we're doing. That doesn't necessarily make us a trusted messenger, but it shows we're paying attention, and that we do have some experts that can speak to that and can add to the conversation. And I think that helps people go, wow, I didn't know Rockefeller did that, and that, gee, maybe I'll start tuning in. We've also really worked out, we have, a big bets community we just started online. And a lot of it is young people. We really kind of try to do toolkits and give them things that we feel will be helpful to them. And so the idea being, there's a lot of activists and entrepreneurs. What are the tools that they can use that we can help them give? What are the opportunities? I just met with the foundation that does a prize about something, and I said, let's advertise that prize on this community, because it's an opportunity for those young activists to apply for that. So I think that also, just those little things can build trust.
Yeah, I think similarly, we really look to our youth voices and lifting those up. We have a community activism and youth engagement division that really builds leadership skills among young people and puts them in a position to be our strongest and I think our most trusted voices on really all of our messaging. The other thing that we do, though, is we pay close attention to where trust is at with our brand and with our messages. So we're continuously tracking that, measuring that, and assessing that, and course correcting as we need to.
I think that was a great note to end on, building community engagement and trust over time. Thank you all. I'm going to ask Steve to come up to the stage again to wrap us up. Thanks for listening.
Just a final quick word. First of all, thank you all for joining us tonight, and thank you, Sandy, Barbara, and Eileen, for giving us a great panel talk. If you're interested in this topic, and as a way of highlighting some of our favorite campaigns, we've launched a new website called campaignbeacon.org. Feel free to check it out. It has some favorite policies, some of the ads you saw tonight on it. And thanks again for attending. Thanks so much.